Typically, when new technology is rolled out, it's designed for larger consumption, so perhaps English-speaking patients or users. The health equity side would be, well, perhaps the minority group or the minority language that's spoken could benefit even more from this tool and making it accessible for them.
Well, thank you so much for joining us today, MacKenzie. I really appreciate it. You recently graduated with a master's degree in public health from the Boston University School of Public Health. And I really wanted to discuss a few topics that you studied during your master's program. I think have a wide application to anyone with any sort of interest in the healthcare industry. So I thought, but as a start, since we'll be talking about things like health equity, digital health equity, artificial intelligence, maybe it would help to start with a definition of what health equity is. Even though the concept has been around for quite some time, I'm not quite sure that our most of the people in our audience will have either heard it or be familiar with it. So can you just tell us just basically what, in your opinion, the definition of health equity?
Yeah, thanks for having me, Chris. I'm happy to be here and share with you. I think by definition, health equity is like the fair and just way of providing care, but I think it goes a little deeper than that, more than just fair. To me, health equity really is considering every aspect of a patient's life, whether that be their distance from a hospital or a doctor's office, maybe their cultural demographics, the language they speak, considering all these factors into providing care. Do they need a translator? Later on, I think we'll talk about digital health, but do they need Wi-Fi to access a virtual appointment? Health equity really encompasses considering more than just providing care, but getting people who have a lower access to care, getting to at least a baseline level of care, not taking away from others, but just getting everyone to an equal playing field.
Yes, and I think that's a great definition. And just from having talked to you before, I know that you are an advocate of the technology piece of that, and also the education, the kind of parallel educational piece of that as well. So just to have a good baseline understanding, would you mind just talking a little bit about that education component that sometimes goes along with health equity?
So in terms of the education, it's definitely important when we're providing care, making sure that everyone understands the level of care that they're getting, or maybe the procedure, or maybe the tool that's being used. Like if we give patients tools such as a patient chart where they can message a provider, but we don't tell them how to use it, the tool doesn't work. It's not effective. It's not going to expand care at all. It's just going to sit there. So I think it's definitely important that we provide resources, especially additional language resources, making sure that everyone can understand the care, the tools, and making sure that they feel comfortable in their care.
Well, expanding on that definition of health equity, which I think is a very inclusive and a good definition, what would you say are digital health equity and inclusive artificial intelligence? I'll just say AI going forward. It's easier. Yeah. So digital health equity and inclusive AI. I know those are two subject areas you studied with a lot of focus at Boston University.
Yeah, so as I was saying about digital health, it's just additional tools and technology and expanding care. But when you add that digital health equity component, it's really making sure, again, that everyone can use these tools and technologies. If we're designing it, I think typically when new technology is rolled out, it's designed for larger consumption, so perhaps English-speaking patients or users. The health equity side would be, well, perhaps the minority group or the minority language that's spoken could benefit even more from this tool and making it accessible for them. If Wi-Fi is needed, not everyone has Wi-Fi, or not everyone has a computer they could sit and have a face-to-face conversation with the provider. So that health equity side really comes into play, and just making sure that it's user-friendly for all users. And then in terms of AI, I think it's the equity side is just making sure that, if you teach, AI is only good as we teach it to be. If you teach it to be racist or biased and you feed it biased information and biased data, then that's what it'll only know how to produce. So including the health equity, or even just generically the equity side into building AI and building the technology, then hopefully it minimizes the likelihood of producing biased results or biased data.
Yeah, that's so interesting. And from talking to you in the past, I know that you believe that health equity is something where we are expanding resources. We're not necessarily taking any resources from,
Mm.
like, say, a privileged group and giving them to an underprivileged group and then just sort of balancing the scales. It's more, and tell me if I'm characterizing this right, an expansion of access to all groups. Do I have that right?
Exactly. Exactly. I think there's like, I've seen graphs before defining like showing equity, and equity would be like if someone is 6 foot tall, they can see over a fence, but someone who's 3 feet tall can't. So giving them a ladder so they could see over that fence. It's not taking something from that 6 foot tall person. It's not giving both of them a ladder or a step stool. It's just making sure that they're lifted up to be, I don't want to say equal here, but at the same playing field, making sure that they have the same access to care, or I guess giving them more access to care, but accessing the same level of care, if that makes sense.
No, and that's a super important dimension of health equity, the definition of health equity, because I think sometimes you can lose people if they think you're taking something away. So I
Definitely.
think it's good that to lead with that, and I'm glad that you have that as a component of your definition. Well, I guess going back to your time at Boston University, what interested you, if I might ask, in these areas during your schooling there?
So at BU, I studied public health and I specialized in healthcare management. And part of that curriculum included a digital disruptions course. That was the title. And so when I first had to enroll in that course, I was very daunted. I like don't know technology super well. I don't know health tools. And then in the class, my professor did a great job. The course itself was just learning about all of the digital tools that are in the healthcare sphere, and perhaps in the future that would be used. And that was just so eye opening of all of these glorious tools that we could use to expand care. But then, you know, my professor, as well as just like myself, like thought about like, well, what barriers are in the way? Like, it's great that you have a platform that you could call your provider and have a 20-minute conversation, but like not everyone could be able to do that, perhaps. So that course in itself just really got the gears going into thinking about how to leverage these tools to be better and to be a means of expanding care. So yeah, that was my
That was
inspiration, to
the
be honest.
entry point.
Yes.
Well, it's so interesting to hear your journey, because I'm thinking we'll probably have some students that'll join as audience members,
Yeah.
and sometimes I think maybe some people have a very clear vision of where they want whether it be their academic career or their job career to go, and they're already on that trajectory. But there's
Right.
a fair number of people who aren't,
Yeah.
and so it's interesting to hear where you started and now where your trajectory is headed.
Yes,
Um,
absolutely.
Absolutely. So now, what are your top? I guess we can pivot to how AI is being adopted right now. What are your top concerns about related to AI and how it's being applied to patient care, maybe now and maybe in, let's just say, the immediate future, because things are evolving at such a
Always.
fast pace. It's hard to maybe think longer than 5 years out. So
Yeah.
maybe where do you see things now, just based on what you learned at Boston University, maybe your own uh, research you've done, and where do you see things going in the near future?
Sure. So when I first started learning about AI and stuff, when I looked into it, and even now today, there's not very many like legal responsibilities for AI in healthcare, and I think AI in general. But I know there's limited legal regulations on AI in healthcare, and so my concern there is accountability. I worry that providers will. I deem AI as being like an assistive tool to help providers, to help caregivers, and just allow providers to have more patient facing time with a tool of AI. And so I worry that providers will abuse the AI and use it as their only means of understanding the patient chart, or maybe the AI is designed to spit out a diagnosis for a complex condition. I worry that like providers will just be like, well, that's what the AI says, so it was wrong, but it doesn't matter. I didn't come up with it. I that's where I fear. I don't want people to be able to write off the accountability of like, you still went to med school, you still have a responsibility to learn about the patient and provide that high quality care.
Yeah, and I think that plays into your worldview, if I understand it right, when it comes to AI, which is that it's sort of has to be a hybrid situation where yes, the AI, you can maybe offboard some responsibilities to the AI, but there still has to be that human component. And it sounds like in your conception that the accountability still would rest with a human, at least in the near future. Is that right?
That's what I would hope. Some tools in AI can like listen to a conversation and write the chart, and that way the provider can talk and to the patient and it just records to that capacity. But it's like it shouldn't be send a bot into the room, send it out. I don't think it'll replace anybody. I think it'll just be helpful.
And that should give people a lot of relief, I think,
Yeah.
is that yes, there is going to be AI to a significant degree and cross cutting across all job sectors.
Industries.
But that said, especially in healthcare, I think there's still going to be a real place for humans. I'm just like you. I agree that there'll still be a strong place for humans. And something we talked about before, actually, almost counterintuitively, the more AI gets involved, and the more, with the accountability still as a component of that, the more that AI gets involved in the more, I guess, mundane tasks that detain doctors from being able to have a lot of one-on-one time with their patients. If that sort of if those sort of tasks can be offloaded to AI, that, like you were talking about, that frees up more time for the physicians to have more one-on-one time with their patients. And maybe that actually, in the patient's mind, will prompt them to have a better
Better.
opinion of AI going forward.
Yes.
Because right now it's people seem a little of two minds. I've seen some polls where people like the idea of AI, but not in their personal healthcare. They like
Right.
the idea in general, like as an abstract concept, but
Right.
not in their personal healthcare. And I wonder if that might help balance that out a little bit.
I think it definitely is a good point. I think some AI tools are as simple as like an Alexa type device that are in hospital rooms where you could say like, "Hey device, turn the lights off." And perhaps a patient that can't get up by themselves would need to press the call button for a nurse to come in. And like we've said in our past conversations, like I think you had said, 2 minutes adds up, 2 minutes adds up and becomes an hour. And that's an hour a nurse could have been doing more like administrative tasks or providing, you know, deeper care to another patient. So I definitely think hopefully it'll allow users to adopt a little bit more and feel more comfortable in that space.
Well, that's such an interesting perspective on all that, and actually kind of feeds into my next question. So, as part of a practicum at BU, as I understand it, you contributed to the creation of guiding principles for integrating health equity into the development and application and distribution of AI tools at Boston Children's Hospital. So I wonder if you could just talk a little bit about that experience and the role you played on the team.
Yeah, absolutely. So last summer, 2023, I was able to be an equity and inclusion intern at Boston Children's within the innovation and digital health team. And my role there was to work with my supervisor, Katrina, to meet with each of the digital product teams. And more complex words, we helped to identify strategies to like mitigate disparities. But what that really means was like we would meet with different digital product teams at the Children's Hospital to ensure that we are reaching and including every patient and family in the digital tools and allowing them to have access to each of the tools. Yeah, and one of the projects I actually got to work on there was in AI. They at the time they were building a new AI internal tool to be used at Boston Children's, and I got to work on helping them develop some equitable guidelines during the build and future implementation of the AI tool, which was pretty cool.
That's exciting. And it sounds like not only did you do that as an exercise for a class, but actually it had a lot of real world application because one of your, I'm not sure if it was a professor, head of the department, took those guidelines then to the White House. I know the White House has been having a lot of listening sessions and trying to make themselves open to the idea of how do we put guardrails around AI. And I think this was maybe part of that larger effort. So can you talk about that and the extent to which you feel like the guidelines, if not acted upon now, might be in the future?
Yeah, absolutely. So after I completed my internship last year, the team further refined the guiding principles and, made them fit better to their needs. And then the chief innovation officer, John Brownstein, he was actually able to attend some of the listening sessions at the White House about like their, their efforts in AI and healthcare. And then later, after John had attended those listening sessions, the White House later announced an executive order. I believe the title is Safe, Secure, and Trustworthy Development and Use of AI. Some culmination of those words. I would need to fact check myself on the title of the executive order, but I do know that the executive order, the principles they suggested in that order aligned with the principles that had been developed at Boston Children's, which is pretty cool. So
That's
makes
amazing.
me feel good to see that building the guidelines overlap with what the White House is thinking in terms of safe AI.
That's great. Yeah. And if nothing else, at least you're on the same page and you
Exactly.
probably have an easier road going forward working together. That's so encouraging. Well, in addition to your work on digital health equity and inclusive AI at Boston University, you've actually also supported an initiative to expand the reach of telehealth at Boston Children's Hospital.
Yeah.
So I was wondering if you could please, actually, for some member of our audience, most people know what telehealth is, I think, at this point, especially after COVID. A lot of people doing online appointments with physicians and healthcare workers. But for those people who may not understand what telehealth really is, can you just give kind of a short definition of that and then how telehealth expansion actually aligns with health equity?
Yeah. So in general, telehealth is, I would say, as easy as joining a Zoom call and meeting with the provider to go over results or have maybe a yearly checkup and just talk and make sure that maybe medications are going okay or treatment plans are okay, or just in general, the person is okay and expressing what's kind of going on in their health. But in terms of aligning telehealth with health equity, I think generically, like you said, people think the technology is there. Okay, cool. We have a Zoom platform to talk with a provider. Perfect. But I think it goes beyond that, thinking about, does the user have, the health equity side would be, does a patient have a phone? Do they have broadband access? Do they need a translator to join that appointment? Considering all of those factors is the health equity side, making sure that everyone could use this tool in expanding their care. And I think that a lot of times it's like, oh, well, in a big city, this would be great because you have such a diverse population and, you could reach so many more people. But also thinking about like rural communities, perhaps some people it takes an hour to drive to a provider. My hometown, it would take 30 minutes to go to the nearest, my pediatric doctor. So like that could be a lot of money for gas, maybe can't take off work. And so considering health equity, it could allow more patients, more families to go to appointments or seek care. Maybe some people are deterred from wanting to call their provider because they don't want to go in, but now they could do it from the comfort of their own home.
Well, and yeah, broadband access. I mean, if you want, even that could be a whole podcast episode right there. In the rural communities, there's just not the level that you would need, you would hope to even have consistent telehealth appointments with a physician in
Exactly.
some cases, not every case. So yeah, it's access, not just in person and not just like with considering transportation, but also the education piece we talked before with technology. Maybe even if maybe people can't even afford the technology in some cases. So I've heard ideas before that maybe are a little pie in the sky right now, but actually seem maybe in the future doable, which is that everyone, let's just say in the country, gets an Apple Watch. and on that Apple Watch is the capability to predict any kind of issues. Maybe it's a spike in blood sugar levels or something like that, that could allow a physician to get ahead of an issue as opposed to reacting to it.
Yeah.
So yeah, I could see a scenario like that really fitting in your examples there with telehealth,
Yeah.
especially.
I think
So
the health equity side to your point about the like everyone gets Apple Watch would be like, well, does everyone know how to use it? Like,
that's perfect
is it up to
example.
the patient? Maybe for like blood pressure. If they get an alert that their blood pressure is high, do they know how to react to that? Do they know if their blood sugar is high, how to react to that? I think that's where the health equity comes in. I think health equity just brings in so many questions. I think just makes you think so much.
Yeah, and I think sometimes we make the mistake, or I'll just say me, I make the mistake of thinking health equity just applies to like underprivileged people, right? And it does to a significant extent. But I think it could also be there could be plenty of privileged people who maybe don't understand a certain technology or are just
Exactly.
averse to a certain technology. So it really runs the gamut. So I just want to put a finer point on that, so
Yeah.
people. So just to explain how inclusive your idea is. Um, so I think now if we could talk to like about a little bit like data visualization. I know you've worked with things like dashboards and things like that. So in my conception of data visualization is accumulating data and then putting in the form of like in a simple example, a graph, a chart, something like that, and then really telling stories through that medium. So
Hmm.
I was wondering, I know you have some experience with that during your studies. So do you agree that data visualization could be used as a powerful storytelling tool in the getting some of the initiatives like we talked about adopted in terms of health equity and inclusive AI? And if so, how do you maybe foresee yourself using this technique to influence the adoption of these ideas we've been talking about?
Yeah, I think you make a great point. I definitely think that like visualization is a great way to convey a story. I think that it could be used at a more, say, higher level leadership position where if leadership or teams could visualize the groups they're missing by their tools, or maybe the population that they're reaching, if they could visualize that and be like, wow, we're missing this group of people and this tool could bring all of those people in and give care, like I think that would be a great way to get adoption. But I think data visualization could also be used at a more like consumer level, at a consumer level, like everyone's all about following trends, and if I see that 90% of people are using this tool and it would help me get care, then I think I would be likely to join the bandwagon and want to adopt that tool too. But I think it's important to note that as well, like with the data visualization, the education component, right? Like we need to make these data visualizations consumable to the average person walking down the street who may see it, or scrolling on their phone who may see it. I think it definitely just needs to be presented in a way that truly is like understandable. It's like, oh, that I want to be part of that, versus like, this is more chaotic, I don't want any part.
Yeah, and we're so used to having so much data thrown at us these days that just to break it down into, these are not simple charts and graphs, but
Yeah,
where at a glance, a lot of people can just sort of at least understand the big trends. I think
exactly.
there's a real part for those tools to play in this story for sure.
Definitely.
Well, we talked a little bit, just to finish up, we talked a little bit, I asked you to look into your crystal ball a little bit about the 5 years or so coming up, and you spoke eloquently about that. I just wonder, if we look 5 years hence in the future or so, what role do you see playing in this changing landscape of health equity and inclusive AI?
Do I see myself playing?
Yeah, I'd be interested to
Okay.
know as a recent graduate, because I think there are people who will be watching this show from kind of all points in a certain career. I think there'll be a certain amount at the beginning of their career. So I
Mhm.
just think it would be really interesting to get a perspective into kind of where you're thinking things are going and how you would like to play a role in that.
Yeah. I think I definitely, I would say near 5 year goal would be just to learn as much as I can. Like my program was a year and a half. My practicum at Children's was 3 months, and I was able to learn so much in that time. But I definitely still have a lot more to learn, and I hope that towards like the end of that 5 years, I hope I'm in a position where I really like the data conveys. I hope I'm able to see the difference that I'm making, whether that be working on a team. And at the beginning, I would love to stay in the digital health space. So maybe if I was working on a team and at the beginning we had 60% users, I would maybe in the 5 years have 90% users. But more specifically, I'd hope that it'd be representative of the population that could benefit the most. I hope to just continue advocating for those.
I love that perspective, because the continuing education part of what you're saying, actually that can apply to people in all different points of their career. Mm-hmm. So I think that's especially important for folks at the beginning. But I think that we're all lifelong learners. So I think that this can be applicable to hopefully everyone watching today. So I think that's a great place to leave it, MacKenzie. Thank you so much for joining us today. And I don't know, is there somewhere online where if somebody ever wanted to reach out to you and continue this very important discussion, are you active on social media, or is there any other place that you recommend people go? Any websites?
Yeah, you can find me on LinkedIn at MacKenzie Hilton. I don't know, can you tag it in the bottom or something?
I sure can. Yeah, I can give it my best shot.
Okay, sounds good. Yeah, you can find me on LinkedIn, MacKenzie Hilton. You can message me through there. That'd be great. But it's been so wonderful talking and sharing with you, Chris. Thank you so much.
Thank you, MacKenzie. We'll have to have you back soon in this ever-changing landscape, and have you help us give us some markers as to where we are and where we're going. So thank you so much.
Thank you.